So welcome, I'm Sarah Harte. I am the director of the dorm in Washington, DC. We are a treatment provider for young adults. And I am here to talk about anti-racism in the mental health field and how we can integrate our shared understanding of how institutional racism has impacted the mental health field and what to do about it moving forward. So thanks for joining us. To start off, here are our learning outcomes. It's important to really start with an understanding of the historical context of white supremacist and structural racism in the mental health field and how that has, baked in some of the problems that we see in the mental health field. And that's going to lead us to understanding some essential anti-racist concepts and then leave you with some skills to be able to integrate into the college and mental health settings that we all work in. So thanks for being here and your time and understanding. Before we get started with the meat of the presentation, I wanted to further introduce myself. We can't talk about these types of things without coming from our own perspective and our own lived experience. So to start with, who am I? Where am I coming from? I can tell you that I am a white, cisgender, straight woman who is a social worker and working with young adults for over 20 years. Before that, though, I started my life as somebody with Irish descent. I was raised in a family where we are taught that everything is pretty even, that there's a family norm of sucking it up and getting through things. That's a strong Irish tradition. I also grew up in Wyoming. So I spent from age 3 to 14, so some really important foundational years in Wyoming, which is a wonderful place to be a kid. It's a complicated place, but lots of really rich history and wonderful traditions as well. When I was in high school, I moved to Arizona and I went to college at NAU, in Northern Arizona University, which is about an hour south of the Grand Canyon, another really, really cool place to be as a young person. And then I transitioned to New York University for my graduate programming. So I got my master's in social work at NYU. And that brought me to the West Coast where I've been ever since. So I think about my own personal experiences being really foundational years in the West and then my adulthood on the East Coast. So why am I talking with you here at HECMA? What the hell do I have to do with college counselor, college experiences? Well, I have been a social worker for 20 years. And about 10 of those years have been working with, in particular, collegiate populations. So after 10 years of working in an outpatient substance abuse program in Southern Brooklyn and Coney Island, I then transitioned to working on college campuses. So my first college counseling job was also my favorite job, which was a semester on semester at sea. So don't get me distracted by asking me about semester at sea, because I will spend the whole time talking with you about that and not the actual presentation that we're here for. But after that, I had the opportunity to be on staff at the counseling center at Barnard College in New York City. Then I moved down to DC and worked at the University of Maryland at College Park and the Health Center, and then spent several years at GW's counseling center before joining the staff at the dorm. And it's been really fun to be able to work at the dorm because it really integrates my clinical training as a clinical social worker and many years working with young adults with mental health conditions, as well as people who are interested in being in a collegiate environment but just need more mental health support. So that's where I'm coming from. That's who I am. I will also say that I'm going to be really talking in this presentation to a lot of my peers. So I want to talk to the white folks in particular, about what is our responsibility to address these principles and these legacies and the historical inaction that we've had over hundreds of years, and that it's our time to really step up and take some responsibility for this work. Of course, everybody is welcome in this conversation, but I'm going to speak from my personal experience as a white woman and in a field that takes social justice seriously, but not that we've always done that the right way. And I'm going to really encourage you all to do some work in this session. I also, wanted to give some credit to some of the foundational concepts that I've learned over my process and journey of learning about my own privileges and my own identities. I had a really powerful experience with an Undoing Racism community organizing workshop several years ago, hosted by the People's Institute for Survival and Beyond. If you haven't heard about them, please click on this link when you get the slides after this presentation and learn about their work and how this might be something that would be helpful for you. I've also benefited a lot from the work of Showing Up for Racial Justice, also known as SURGE. They have local chapters, and I participate in the DC chapter and have learned a lot from my peers at SURGE. I also put this image in here about doing homework. So this is going to have some homework. So I've embedded a ton of links, lots of resources. This is just the tip of the iceberg. This is just the very beginning of this conversation. There's no way I can go through and unpack all of this history of hundreds and hundreds of years in a 45-minute presentation. So please understand that this should be the start of the conversation, and I'm here to continue it in whatever way you would be interested in, but I also want to share a lot of resources for you all to go off and do the homework. So how long has it taken for us to get here? A real long time. Just this year, just a month or two ago, April 8th, the Center for Disease Control and Prevention issued a statement that declared racism as a serious public health threat. And this is a response and a lesson learned from COVID in particular that really highlighted something that a lot of people have known for many, many years, which is that a growing body of research shows that centuries of racism in the community, in the country, has profound and negative impacts on communities of color. And so this overdue statement from the CDC is a result of hundreds of years of work, but here we are right now. Also, just this February, so here we are in 2021, people have been thinking about this and been in the streets asking for change for generations. And now here we are just starting to see some of these steps being taken by the CDC. And recently in February, the American Psychiatric Association, which is the oldest medical professional association related to mental health, actually apologized to Black, Indigenous, and people of color for over 200 years of institutionalized racist practices. It was really meaningful and overdue, but here we are to issue an apology, recognizing that early psychiatric practices laid the groundwork for the inequities in clinical treatment that have historically limited quality access to psychiatric care, and subjected persons of African descent and Indigenous people who suffered from mental illness to abusive treatment, experimentation, victimization in the name of scientific evidence, along with the racialized theories that attempted to confirm their deficit status. So these are powerful words, but it was a long time coming. And when we think back as a mental health professional, a lot of the foundations that our field was built in are very problematic. And so I'm proud of the APA for making this apology, but it's just the beginning. One of the things that I'd like to do is just really talk about the impact of this, of generations of racial bias in mental health. And the APA, the American Psychiatric Association, went on to unpack some of their own history in understanding why they needed to make this apology to Black, Indigenous, and people of color, really recognizing that there were prevailing Black stereotypes in psychiatry that led to doctors thinking that patients were hostile, unmotivated for treatment, had a primitive character structure, that psychiatric misdiagnoses among Black, Indigenous, and people of color throughout decades were common, and even through the 20th century, where psychiatrists commonly attributed minority patient frustrations to schizophrenia, while characterizing similar behavior just as neuroticism in white patients. So the presenting problems that two patients had were interpreted very differently based on their race. So what this did is, after hundreds of years of this in the field of psychiatry, which then came up through the fields of social work and counseling and psychology, it baked in some of these institutionalized practices and institutionalized stances of racist practices that we need to really understand and look at, so that we can understand how to unravel some of this work when we're talking with folks in a mental health perspective. And even if you're not a mental health practitioner, it's really important to understand that this is what's happening in the mental health field, because all of you are in a position of intersecting with students who might have mental health conditions or might be resistant or hesitant to seek out mental health care. And this is a reason why for many, many people. So implicit bias is a consequence of inaction and legacy. You might know the definition of implicit bias, but if you've not heard a lot about it or not done a lot of work on it, there's some really wonderful resources, for instance, at the Perception Institute. But implicit bias is learned but unconscious attitudes towards people that more reliably predict our behavior than conscious values. So we might say consciously that we don't discriminate, but actually implicit bias more reliably predicts our behavior that there is discrimination because of that implicit bias that's unconscious but learned. The lack of diversity in mental health profession is a significant problem. In all mental health disciplines, the vast majority of providers are white and less diverse than the US population as a whole. American Psychological Association recently said, I think 2015, that over 80% of psychologists are white, which is clearly not reflective of the population that they serve. And that's true for social work, counseling, and other fields as well. Because of this lack of diversity and the baked in implicit bias, there's often frequent racism, microaggressions, and barriers to accessing provider with shared identities. So if somebody is looking for somebody who shares an identity, they might have a hard time finding them, especially in areas that are rural or across the country, even in urban areas as well. Implicit bias is something that we've all been taught, and it happens to all of us. It's not something to feel ashamed about, it's something to become aware of. And so if you haven't checked out the Harvard's Implicit Bias Project, it's so cool. It's really upsetting too, because it raises to your consciousness things that you would rather probably not be aware of. But once you're aware of it, you can do something about it. So I really encourage you to check out the Harvard's Project Implicit, which is an opportunity to take some tests about understanding where are your biases and uncovering that and becoming aware of it. The barriers to care are a significant consequence of this inaction and the legacy of hundreds of years of institutional racism. So compared to white patients, Black, Indigenous, and people of color are more likely to be perceived as dangerous, more likely to be restrained and coerced and or medicated in psychiatric ERs. We know this is true for other fields as well, in particular policing and the criminal justice system. So we are not unique in that way. It's really cuts across, but it is not, but being a mental health provider does not make us an exception. We are part of that. People of color, Black and Indigenous people are treated more with drugs than psychotherapy. And they're more likely to be misdiagnosed or diagnosed with a serious mental illness like schizophrenia, while also simultaneously being underdiagnosed with things like post-traumatic stress disorder and mood disorders. So there's bias in the diagnostic criteria, which is going to change the way somebody's treated, and also how they understand their own symptomology. Additional barriers to care: compared to white patients, Black, Indigenous, and people of color are less likely to have access to mental health services. They're less likely to receive the needed care that they need. They're more likely to receive poor quality of care, and less likely to seek out services because of all of the things I just said. If you don't have access in the community where you come from, if there are not folks that look like you or have shared identities, if the care that you're getting is misdiagnosing or there's poor quality of care, then of course, I'm going to be less likely to seek out services in that case too. Another consequence of this legacy is white supremacy. So we need to accept that the system is designed, the mental health system and many other systems is designed to prioritize the needs of white patients, white students, and white providers, and that comes at the cost of people who are not white. And white silence and white apathy contribute to maintaining the status quo. So part of white supremacy is being taught, like I was in my Irish family, to keep quiet, not rock the boat, behave ourselves, keep a firm upper lip and just get through it, muscle through it. And that's white silence. I was taught to be quiet about these issues. So it takes a risk to go against what I was taught from my community to say, no, I'm not going to be silent. And we need to understand how that silence and apathy is really baked into the ideas of white supremacy to maintain that status quo. You might have heard of an author, Layla F. Saad, who wrote a book called Me and White Supremacy. It's an excellent book if you'd like to read it. There's been some debates about her source material and not giving credit where credit's due. So please do that research too, so that you can understand who were her mentors and people that she's learned from. But there's some good information in that book. And so Layla says, if you are willing to dare look white supremacy right in the eye and see yourself reflected back, you are going to become better equipped to dismantle it within yourself and within your communities. So it's a brave stance, but it's so, so important. In addition to the foundational principles of white supremacy, maintaining the status quo of a system that benefits white folks, the providers and patients in the mental health field, it also comes with some really classic stances of white supremacy. And you'll probably hear this or kind of start thinking about a college campus environment when you hear this, because actually what I think of a lot is that a lot of these kinds of concepts of white supremacist behavior are what we see on college campuses a lot. So these are some examples. And this comes from our friends over at Surge for Showing Up at Racial Justice. You can see the link here to see the whole list. And what they did, a really wonderful article that really outlines what are some qualities or some components of white supremacy. And then in parentheses, I included what they laid out, which is also the antidote to some of those. So this is just a simplified list, but I really encourage you to go read the whole thing. So one component of white supremacy is perfectionism. And the antidote for that is developing a culture of learning and appreciation. And if you do nothing else in this, if you get nothing out of this presentation, even if it's not about mental health, I think teaching our students what the antidote of perfectionism and some of these components are is such a gift for them. Also, a sense of urgency is a part of white supremacy, and the antidote to that is realistic work plans. So we can take that to heart, thinking about campus work, thinking about the pace of semesters, thinking about the amount of work we're asking our students to do. Another component is either or thinking. So really encouraging folks to think about both and. It's not either or, it never is. I shouldn't say never, because that's almost always isn't. Never is also an extremist way of thinking, but really thinking about both and. Defensiveness, stance of defensiveness is a component of white supremacy. And so what we need to do is we need to understand the link between defensiveness and fear, in particularly the fear of losing power, losing face, losing comfort, and losing privileges, those of us that hold white privilege. There's a concept of there's only one right way to do it. And we need to accept that there are actually very many ways to get to the same goal. And the more that we accept the fact that there are lots of paths towards success, there are lots of ways to be successful, there's lots of ways to accomplish a goal, the more inclusive our communities are going to be. And a core component of white supremacy is the right to comfort, that I have the right to feel comfortable. But what we need to do to dismantle that is to welcome discomfort and the growth and learning that comes with it. So even this presentation might make me feel uncomfortable. It makes the audience at times feel uncomfortable. And that discomfort can help push at the edges for those of us in particular who hold white privilege. So those are just some of the components, some tiny components of, or not tiny, some big components, but tiny summaries of components of the legacy of this inaction or these baked in principles. In particular, I'm talking about the mental health field and acknowledging that these things do happen in this mental health field. So now I want to say, okay, well, what do we do now? And what we do now is understanding that these things are baked into our field of mental health providers, baked into lots of different components of our culture in the United States, baked into college campuses. What do we do now? So how do we do the work? I gave you some homework here, a list. This is not an exclusive list. This is not all of the things you need to learn about, but some really important components to learn about, to go off and do some homework. White fragility and white apathy. I talked about that. Layla Saad talks about that in her book, White Supremacy and Me. White fragility, there's a link there to the text that Robin DiAngelo wrote about the concepts of white fragility. Learning more about white supremacy and white privilege. Actively unlearning implicit bias, knowing that implicit bias is taught to us, so we can actively unlearn implicit bias. We need to raise our awareness of microaggressions and how to intervene with those. We need to understand racial trauma and how racial trauma impacts our clients over the course of many years, a life lived of experiencing microaggressions and other aggressions based on racism. Racial identity development is a really wonderful thing to learn, especially as we help our young people on college campuses and in mental health environments think about their own identity development. You know, how do we want to be in this world? How do we want to be as a learner? How do we want to be as a student? What are we working towards? And understanding that identity development happens as we go through developmental stages of growth, young adulthood or emerging adulthood. It also happens as we learn to understand our own racial identity. And then I just gave you the link for Showing Up for Racial Justice Surge at the bottom here, because they have such wonderful resources in addition to the resources that I've embedded into this list. So how do we bring anti-racism to our therapeutic practices or on college campuses and foster anti-racist mental health spaces on and off campuses? So we've already talked a little bit about this in my opening kind of slides, but this is really important about digging deeper, understanding that the person sitting in front of us, whether they're coming in for advising or they're utilizing campus case management, or they're being referred to the counseling center, or they're being seen in the counseling center or health center, that we might start, especially those of us in the health field, whether we be health center staff or mental health staff, we might start with that medical model, or we might start with a DSM pathology. But we really need to go past that and understand that each of us bring with us a history and lived experience. That might be trauma or other kinds of experiences we've had. And for folks who don't hold white privilege, for students of color, Black students in particular, Latino students, Indigenous students, that really understanding that there's so much more when it comes to xenophobia, racism, oppression, all the kinds of inequalities that happen due to race. So I liked this image to just kind of give us something to think about digging deeper for. And what I really encourage all of us to do and invite you to think about is making anti-racist practices or anti-racism a value versus a priority. So we often kind of use those terms hand in hand, but it's actually really helpful to break down what's the difference between a priority and a value. And this is something I teach the students that I work with. A priority is something that's important, but that important changes due to outside influences and demand. So, a perfect example actually is the CDC statement. How are we now having this statement in April 8th, 2021, where people have known for years that health inequities happen due to systematic racism? Well, it's a priority because this is the administration change. I'm talking to you here from Washington, D.C., so if I could look through my wall, I might be able to see the White House. So those priorities change with administration changes. Same thing happens on college campuses. Priorities change based on the leadership of the university. But what we need to do is understand that those priorities can change. And we want this to become a value, which means that it's a core principle that outside influence or demand is unable to change. So if we make this anti-racism work a value, it will last longer than a series of priorities that maybe leadership has put in place. So I really challenge you to think about how you can enact that change within yourself and within your work on campus. Some other skills that I wanted to share with you all in thinking about how do we start to bring these things into our work on a daily basis, whether they be with our colleagues or the students we're working with. What do we do? And I started this conversation by saying I'm going to be talking with my white peers. And one of the things that we need to do for people who hold white privilege is to understand that there are ways that we need to show up in multiracial settings where it allows for the work to happen. And that we need to make changes to the way that we approach this work. And again, this is based on the work of Surge and things that I've learned from my peers in Surge. And there's a list, an extensive list in the link that I have at the bottom here. But to summarize, these are some best practices for participation in multiracial settings. So when showing up for these conversations, we want to make a commitment not to strive to prove that we're allies, but to behave as an ally. That being an ally is a verb, not a noun. So that addresses some performative allyship. It's not really in just what we say, it's in what we do and how we show up. And that we do need to prove ourselves in this area because we've proved ourselves otherwise and so for so many generations. We need to not be expected to always be invited, that it's okay for white folks not to be included in some conversations. It's okay for folks to have affiliate spaces that are just for people of color, just for Black students, just for Black staff, just for different affiliations, and that we don't have to be included in those spaces. We also have a shared commitment in the principles of Surge to not say that we understand how someone feels, because the fact of the matter is that I don't. I can hear, I can learn, I can seek to understand where people are coming from, but I have not had that same lived experience, so I'm not going to say I understand it. We prioritize listening over speaking. In addition to that, we strive to decenter ourselves, so I don't need to be the center of the conversation when in a multiracial setting. And we hear criticism and we apologize as needed. And so those are really important when intersecting with our colleagues and our students in a multiracial setting. Just some examples of how we integrate some of this sort of thing at the dorm, just as an example of how to maybe bring it into some programming that's happening on campus or in different mental health spaces. I will actually say I need to give credit where credit's due, that college campuses are often, and college communities are often well advanced than the rest of the world in some ways. That doesn't mean it's a guarantee. It takes some work. But thank God for students. They really push us to look at ourselves and to push ourselves to be always learning. And so that is a really rich experience for a university setting. It's not always the case in other settings outside of university settings. But just some examples of things that we brought into our treatment experience at the dorm. We focus on building skills at the dorm. And so that means that we teach people skills of managing their emotions, and we teach people things like money management. We teach people adulting skills all the time. That is the case for lots of folks on university and in university communities too. So anti-racist skills can and should be taught. So, while we're busy teaching young people how to adult, we should also be teaching them how to adult in an anti-racist stance. And one of the most wonderful books and resources out there is How to Be an Anti-Racist by Ibram X. Kendi. And if you haven't read that book, I strongly recommend you do so. Part of those anti-racist skills is really recognizing and intervening in microaggressions. Microaggressions are one of the most common ways that racist practices are happened and upheld over and over and over again. And as we become more aware, we have to learn this as white people. People of color don't have to learn it because they're experiencing it all the time. But as you start to become more aware as a white person, you start to feel uncomfortable. Ugh. And I make this face like, ugh. There are lots of times when something doesn't sit well, and I start to feel it in my body or my gut or my face before I even have the understanding or conscious awareness. And oftentimes recognizing and intervening is by simply making a noise. Like I don't have the right words, or the words come to mind fast enough, but I want to say like, oh, whoa, and that's how I do it a lot. Other people might be more eloquent, and I have some examples in the next slide. But we also teach people how to learn skills of advocacy and bystander intervention, how to stand up for each other. We also want to explore people's identity development. So we bring that into identity development as a whole, but including racial identity development. We have some programming that we include for all of our participants at the dorm. One is called Justice, Service, and Advocacy, where it's looking both inward and outward and talking about how we as a community can be more justice-minded, how we can be of service and be advocating within our community and outside of our community. We have book clubs where we read things like How to Be an Anti-Racist and learn together. And we also are in the process of developing a Black, Indigenous, people of color support space. Actually, that's probably old news on a lot of college campuses, and we're taking a note from that about how affinity spaces are so important, not only for students of color, clients of color, but also for white folks to do the work among ourselves. So that's a space that's in a process that's in development here at the dorm. So this is just an image we have actually up in our office, and I wanted to share with you all. That one of the things that I love about social media is you can use social media for good instead of evil. And I really encourage the young people I work with and my colleagues to really curate their Instagram feeds or other social media that they have to give them, whether it be mental health support or body positivity or advocacy around anti-racist practices. There are ways to really follow accounts and folks who are spreading the good word as opposed to social media's evils, which are comparative and dismissive and can be very anxiety provoking. But anyway, I got this off Instagram. And it's just really, can be really helpful. Sorry, Elizabeth, can you just go back? It can be really helpful to just give people examples of things to say. Hey, that's not okay with me. Or, ooh, that's not funny. Or, wait, what? That's when I say a lot. Wait, whoa. I just need to buy myself some time. Or, I find that offensive. And having some of these statements that I like to call pocket statements, things that you can just pull out of your pocket in a moment, is a really important skill for all of us to have when it comes to interrupting microaggressions in particular. And finally, just a call to action. So, what are some things that I encourage you all to do, and some resources that you can look at in addition to what I've already shared? Really talking about like I said, developing affinity spaces to have hard conversations And in particular, affinity spaces for white folks, you know, to come together and do some of the work on our own, take responsibility for this and say, hey, what are we going to do? And how can we learn these skills and teach each other so that we're not burdening our colleagues of color, and we're not needing our students to teach us this, but we're taking responsibility for it as well. And there's a really wonderful resource talking about race that's from the Smithsonian Institute, another Washington, D.C. Local community resource, but it's a really great resource to utilize in supporting some of these conversations about how to talk about race. I really encourage people and you to leave this talk and think about, you know, what are some areas of oppression within your work practices? Are there anything around white supremacist kind of principles or areas of implicit bias that you have the power to undo? Are there ways that people access your services that they need to jump through some hoops that might be oppressive? Are there ways that you could make, you know, the way that people interact with your office more inclusive? Learning the skills of intervention for microaggressions, we've talked about. This is an ongoing process for me. I get so disappointed in myself at the end of the day when I know there's something that happened that I could have said something, but I give myself permission to say, listen, you know, I'm not perfect. This is not a perfectionist thing. This is a work in progress, and I'm going to do my best every day. Some days I do great, other days I do medium, and I can always come back and recognize when I make a mistake. You will make mistakes. And what I say is apologize one good time. What ends up happening sometimes is people are so humiliated or so fragile about the mistakes they made, they just keep apologizing, but that makes it about them. So just say, own it, and I'm sorry, and I'll do better, and move on. I encourage folks to amplify the voices of Black and Brown students, colleagues, professionals, writers, teachers. We need to use our privilege to make sure that they're centered in this conversation. And, you know, there are often really cool experimental activities, and there's some names of some things that you can Google or look up, but I'm sure you might have some colleagues that might have some good creative ideas too. But 5 moments is a time when people put five experiences that they've had in their life, which have been transformative when it comes to understanding their own race or their own understanding of racism. I Am But I'm Not is about addressing racial stereotypes, saying that I do have an identity, but that doesn't mean that I have the stereotypes that go along with those identities. As an example, I am Irish, but I don't drink, right? And so there's a stereotype around Irish people drinking all the time. Sure, there are some Irish folks that do. It's part of the culture, a part of the culture, but it doesn't mean that it's me. And there's a really interesting one about uneven resource distribution where you break the groups up into different groups and give them different resources and ask them to achieve a task. And it's a really, really informative exercise to understand what happens when you don't have the same kind of resources or don't start off on the same foot as other people. So look into some of those experiential activities. There are lots of things going on college campuses that you all might be able to teach us, but I wanted to lift some of those resources up. And these are some of the information where I got some of the data about health disparities, but also some more reading to do on your own. And I really encourage you, and we'll make sure that HECMA is able to get you all the slides so that you have all of these links. But obviously this is also a recording, so you can go back and you can really look into and do some Googling on your own, some of these concepts. So thank you so much for your time and interest in this topic. I really look forward to following up with a question and answer session at the end of these slides. So I look forward to talking with you further. Thank you.